So now we're going to discuss cardiovascular exercise prescriptions. This is probably one of the more lengthy topics that we will discuss, as it's very important. There's a lot of facets to it that we can use to individualize prescription for cardio. The first thing we'll talk about is what is cardiorespiratory capacity. Well, cardiorespiratory capacity is the maximal ability of the body to perform large muscle movements or large muscle dynamic exercise or work. So there's a lot of adaptations when we utilize aerobic training. As you can see, you could pause this video and slide and kind of look a little closer about increasing the size of the left ventricle, which is a positive response or a positive hypertrophy. Not always is left ventricular hypertrophy positive, but in the case of adaptations to aerobic training, it is positive because it causes increased filling and contraction to push more blood out with each beat, so that enhances stroke volume essentially. So we have a higher cardiac output, we have vascular adaptations to deliver blood, so we have a greater ability to transport oxygen, but we also have a greater ability to take up that oxygen by the muscles because of increased numbers of capillaries and increased myoglobin in the muscle cells and more mitochondria and enzymes. We also have better alveolar ventilation, so we have better exchange of CO2 and O2, pushing CO2 out into the environment, taking in O2 to utilize and improve our maximal oxygen consumption. So whenever we're looking at creating a cardiovascular exercise training program, obviously we want to start with assessment. We always start with the needs and the goals of the client. This could vary based on client goals, from maybe weight management strategies to improving their time for a 5K to being able to walk around the block without getting winded. We want to select the appropriate training method, activities, and equipment based on that, and we'll talk about that a little later. And we will talk about the FIT principle more specifically based on our client's training status and their goals and their needs a little later as well. And then what it looks like to progress and what it looks like to warm up and cool down. So with the setting, we might be looking at clinical versus health and fitness. Obviously with the clinical setting, our goals might be a little more based on functionality and getting back to those activities of daily living following a cardiovascular event, possibly in cardiac rehab, or somebody with pulmonary or cancer, pulmonary disease or cancer. We will be looking at what can we do to improve their functionality and get them back to activities of daily living quicker. With program goals, we might be looking at weight loss or athletic performance, or again, being able to walk around the block without getting winded. And then with the clientele, we might be looking at low fit clientele or high fit clientele. Obviously with high fit clientele, we have to be a little more creative and possibly do some more high intensity training, whereas with low fit clientele, we're going to see some basic improvements in them from simply low intensity, shorter duration activities. So what are the current recommendations for cardiovascular exercise? Well, our FIT principle, or our intensity piece of our FIT principle, involves VO2 reserve, which is same recommendations as heart rate reserve. So with moderate intensity exercise, we want to exercise at 40 to 59% of our VO2 reserve or 40 to 59% of our heart rate reserve. And we want to do this 30 to 60 minutes per week for 5 days a week. If we want to work out at vigorous intensity, we can work out for less frequency of 3 days a week, but we need to be over 60% of our VO2 reserve or 60% of our heart rate reserve. And this typically is going to be 20 to 60 minutes. The general rule is we can do 20 to 25 minutes of vigorous intensity activity and 3 days a week, and that is essentially equivalent to 150 minutes of moderate intensity per week when we're looking at aerobic training adaptations. Sedentary individuals should complete 3 days a week of moderate intensity, alternating days. We want them to have that rest and recovery in between so that they come back motivated and they don't get burnt out and they have time to recover and it's feasible for them to do, and we're not scaring them off of an exercise program. With longer duration, moderate intensity activities for moderate intensity, we are developing endurance and a large volume of energy expenditure, whereas vigorous intensity, we're more focusing on the development of aerobic capacity. So here's some examples of some moderate and vigorous intensity activities. Note that moderate is anywhere from 3 to 5.9 METs. Examples might be walking 3 to 4 miles an hour, washing the car, or gardening, whereas 6 METs is vigorous, 6 or more. And we're looking at more strenuous activities such as bicycling over 10 miles an hour and roller skating or jogging and walking or playing a sport. Note that running is the most common vigorous intensity physical activity taken part in. So with thresholds for change or intensities that we might use to increase VO2 max based on our initial fitness level, if we have a low to moderate fitness level, so less than 40 milliliters per kg per minute VO2 max, then we're actually looking at working out at 30% VO2 or heart rate reserve, and this will actually improve our aerobic capacity or our VO2 max if we just simply work out at just 30% when we have a low to moderate VO2 max to begin with. Now, if we have a very high VO2 max, which would be above 60, we would want to work out often at 90 to 100% of our VO2 heart rate reserve. So we're needing to have workout bouts that cause us to utilize our maximum capacity. If we're looking at an initial fitness level and training and intensity and our ability to increase VO2 max, we notice that light intensity for those with VO2 of 40 to 51 is not going to do much for VO2 max. So we need to get over a 40% workout intensity for VO2 max. Now, we also see that with less than 30 of an initial VO2 max, for our sedentary or low fit individuals, it doesn't really matter if it's light or moderate intensity because they will get approximately the same effects. So you can see on the chart that there's about a 11% increase in light and moderate intensity activity for sedentary individuals. And we can see that all benefit more from vigorous intensity when it comes to increases in VO2 max. However, given the low sedentary nature of low fitness individuals, we might want to start off with just light intensity for safety purposes and because it elicits the same results as moderate intensity, and then work our way up from there. So when looking at a target heart rate range, we often use heart rate reserve, and you've heard me discuss this alongside VO2 reserve. They're calculated essentially the same way, just with different variables. So heart rate reserve is a little better than just VO2 max or heart rate max because it takes into account the resting heart rate of the individual. So it does not matter if they're a cardiac patient or an elite athlete, they're still going to have an accurate heart rate reserve because it's based on their resting heart rate. So what we do to get our target heart rate from heart rate reserve is we take our maximal heart rate, which can be calculated as 220 minus our age, or via other calculations, and minus our heart rate at rest. From that, we'll multiply that by the actual intensity that we want to work out at. So maybe we want to work out at 60% heart rate reserve or 50% heart rate reserve. If we have a low fitness individual, then remember 30% is fine. And then we add back in our heart rate at rest. So what I want you to do now is take a second to calculate your target heart rate range based on the intensity you'd like to work out at and your heart rate at rest. For our target heart rate range, we can also use heart rate max. Just note that when we use 220 minus our age, if we're under 40 years old, it commonly underestimates our actual heart rate max. And if we're over 40 years old, it commonly overestimates our heart rate max. Therefore, it might not be the most accurate means of prescribing exercise. A better way possibly is to calculate heart rate max based on the following formula: 206.9 minus 0.67 times your age. This is actually a little more relative, a little more accurate measure of heart rate max. Now, the recommended range when we use heart rate max is 64 to 94% of max heart rate. That is the range that we're looking at as far as prescribing exercise. Now, if we have a deconditioned individual, we'd want to shoot for 57% of their heart rate max for their prescribed intensity. There are a few other calculations for heart rate. There's the Astrand calculation, the Tanaka, the Gelish, and the Gulati. So all have been based on research. Some have been used on different types of populations. The one that's been used mostly for our general populations are the Tanaka and the one that I mentioned previously on the previous page. We can also use RPE and the talk test to monitor exercise. So with the talk test, we're looking at being aware that you're breathing harder to being able to speak in complete sentences without gasping for breath. So what we want to make sure is that exercise is comfortable for the exerciser and they can still talk and respond to exercise if we're looking for a moderate intensity. Now, if we're looking for maybe something a little more challenging, we want to look for them to be barely able to respond in conversation. This should still be safe and appropriate for cardiorespiratory endurance improvement. It's very useful. It actually has been shown in research to closely reflect actual heart rate and VO2 levels. In one study, it actually showed a close relationship with VO2 and ventilatory threshold and heart rate on both the cycle ergometer and the treadmill. So the talk test could be useful. So when comfortable speech is no longer possible, the exercise intensity seems to be greater than what is normally recommended for those individuals. So we want to make sure that they can still have comfortable speech when using the talk test. Now, RPE is also something that we can use that's pretty easy to use and can be used anywhere. We don't need special equipment or to take any measurements. We just need to ask the individual how hard they perceive they're working. So we can have the scale of 1 to 10, and we can have a scale of 6 to 20. So we can see that when we use a scale of 1 to 10, a 5 is somewhat hard, and it's similar to a 13 on the Borg RPE scale from 6 to 20. Now, it's up to you what scale you want to use. The 1 to 10 scale is a little more easy for clients to understand. So if we say, tell us how you feel on a scale of 1 to 10, it might be easier for them to relate that an 8 is hard than that a 16 is hard on the scale of 6 to 20. However, some research has shown that the Borg RP scale is a little more likely to reflect actual heart rate. So if they say they're at a 15, then it could be likely that their heart rate is at a 150. When they say 20, it could be likely that their heart rate is close to its max. Now, this is based on age-predicted heart rate max, so it is not completely reliable for every individual that you use it on. So you should use your best judgment to determine which measure of RP you'd like to use. It's also important to note the relationship between RPE and percent heart rate max and VO2 reserve and heart rate reserve. For instance, when we are at a VO2 or heart rate reserve of 70, we're likely at a 7 or a 15 on the RP scale and an 84% on the heart rate max scale. The numbers in red are going to be more vigorous intensity activities, whereas the numbers in blue are going to represent more moderate intensity activities. Higher intensity activities may elicit a greater aerobic benefit. However, it should be noted that there is an increased risk for cardiovascular and orthopedic injuries with higher intensity activities, and there's also a decrease in adherence when using higher intensity activities, specifically when we're looking at individuals who are sedentary or have not been trained in a while. So it may not be worth the benefit to prescribe high intensity exercises for those sedentary clients, specifically if they're at risk for those sorts of orthopedic or cardiovascular injuries. We want to actually use their program objectives and individualization of their goals to help define the intensity. When looking at the fit variable of time, we want to look at 20 to 60 minutes as far as our workout program goes. So with vigorous intensity, again, we can work out at 20 to 25 minutes, but with moderate intensity, we may want to shoot for 30 to 60 minutes, specifically hitting 150 minutes per week of moderate intensity or 70 to 75 minutes a week of vigorous intensity. With weight loss, many programs and organizations state that you need to work out up to 90 minutes aerobically every day to achieve improvements in weight loss. Specifically, the Institute of Medicine says 60 to 90 minutes of aerobic intensity a day are necessary for weight loss. This is to meet the requirement of 2,000 calories a week or more burned from activity. Now, we should proceed with caution whenever we're prescribing exercise frequency and duration. While I said that 90 minutes of activity was significant for improving weight loss, we also want to make sure we balance recovery, frequency, and duration. As you can see by this chart, there are greater improvements in VO2 max from frequency and duration, from greater frequency and duration. However, the injury rate increases quite a bit when we jump from 3 days a week to 5 days a week, or 30 minutes to 45 minutes. Notice there's not much difference in injury rate from 15 to 30 minutes of activity. However, that extra 15 minutes to jump to 45 minutes a day causes a greater increase of injury. When looking at type of exercise, we want to do continuous rhythmic exercise. Specifically, when we're looking at beginners, we may not want to add in high intensity training or interval training, unless it's moderate intensity interval training, to the program. As fitness levels increase, then we might want to add in more activities of a greater variety, such as swimming, racquetball, basketball, things that might challenge their skill level a little more. The MET values will depend on skill and effort, so that should be taken into consideration. We also want to consider weight bearing versus non-weight bearing. For instance, if we want to reduce the risk of osteoporosis, we'd want to engage in weight bearing activities. This is going to increase our bone density and improve our muscle mass. However, if somebody already has osteoporosis or an orthopedic injury, we'd want to focus on non-weight bearing activities such as cycling or swimming. Now we'll get into the exciting topic of cardiorespiratory endurance for sport. There's a few different training methods we're going to discuss. The first one is training at long duration for moderate intensity. So our goal with this type of exercise is going to be to improve our cardiorespiratory function, specifically our VO2 max, and improve our ability to utilize substrates, specifically carbohydrates and fats, and improve our muscular endurance. This is going to be for somebody who wants to complete a long duration activity. Could be anything from a 5 or 10K to a half marathon, or just wanting to be able to leisurely jog for 30 minutes around the block. This is going to involve continuous exercise, and it's going to usually take place at 60 to 70% of our VO2 or heart rate reserve. The pace that this training method should entail would be slower than a race pace. So that would be about a 6-minute mile for elite runners. For the rest of us, probably a little slower. However, it should be noted that this is not a high intensity pace. It's slower than a race pace. It's a long duration activity. We're strictly looking to optimize the variables that I previously mentioned. The next training method is going to be moderate duration, high intensity exercise. So this is where we're looking to improve our pace. So we're doing this pace or this tempo training. A tempo run should consist of a warm-up and then will increase in intensity throughout and then finally contain a cool down. If intensity is set higher, then we might have to decrease the duration or the body may not be able to respond. So we have to be careful, depending on what intensity we set, how long we do our tempo training. So the purpose of this would be to get accustomed to race pace. So we might actually be at faster than race pace at some periods throughout this training method. One example might be exercising for 10 minutes at a 7-minute 30-second mile pace, then 25 minutes at a 6-minute 45-second pace, and then 10 minutes at a 7-minute 30-second pace. Now, this is a longer duration tempo training method. Some people prefer to do a shorter duration tempo training method, such as repeat 400s, so running 400 meters as fast as they can several times with a break in between to increase their race pace. The intensity should be set near lactate threshold when performing that pace or that tempo training, that high intensity area. So we want to look at 85 to 90% of heart rate max. We're also looking at 30 to 60 minutes, depending on intensity, as I mentioned before. Short duration, very high intensity, or interval training would be to improve specific areas of a race. So improving that final kick or improving hill running time, so we want to improve our power or simulate a specific rate stay. So we want to be very specific. This one kind of blends with the last method mentioned, depending on what we're looking for in our racing goals. Okay, so with this, we might actually do those 400s more likely now and do sprint intervals that require less than 2 minutes of time. So this intensity can actually be at super maximal VO2. So it could be over 100% of your VO2 max. We might actually hit a VO2 peak higher than our VO2 max with this training method. We should choose a pace based on the interval that we're doing. So we might have quarter repeats or 800 repeats or hill repeats. And we're going to actually perform them as intervals, possibly in the middle of a longer run. So we might run a mile or two and then perform the intervals to mimic a race day at which we would have hills or sprints or a final kick intertwined within our race. Research shows that interval training is the best way to increase VO2 max. So how can we overload and use interval training to increase our VO2 max? We might increase our intensity, we might increase our time spent at higher intensities, and reduce our work to rest ratio, allowing for less relief. With repeated bouts of high intensity exercise, we want to always alternate with periods of relief. This could be complete rest or active recovery. What we're looking to do is maximize the work that we're doing and have less fatigue to be able to work out at a higher intensity for a longer duration during our workout. One example of a 1-to-1 rate training ratio would be to do a 800-meter run and then rest for 800 meters. That would be a longer work interval. 800 meters is quite a long interval to complete at a high intensity. If you've ever run a rate 800, I think you probably know exactly what I'm talking about. Now, if we're looking at middle duration work intervals, we might have a 1-to-2 rest ratio. So we might run a 400 and then rest for 800. This allows us to have a little bit more relief time compared to our higher intensity time, because we should be able to run at a higher intensity for 400 meters than we can for 800 meters. When we do less than 400 meters, we probably want a 1-to-3 ratio. This might look like running a 200 and resting for 600 meters. This 200 would be a very high intensity workout, so we would need possibly triple the time for rest so that we could recover and run another high intensity 200. When looking at the training systems that we train, we want to look at the ATP-PC system, the anaerobic glycolytic system, and the aerobic system. With the ATP PC or the ATP creatine system, we're looking at exercising at 90 to 100% of our heart rate max to tax that system and train it. However, with the anaerobic glycolytic system, we're going to be training anywhere from 85 to 100% of our heart rate max, and we're looking to train our aerobic system and improve that aerobic capacity, we're looking at training at 70 to 90% heart rate max. So there is a table in your book on page 163 I'd love for you to look at called Recommendations Based on Our Energy Systems. You should become familiar with that table and look at the different recommendations based on those systems. Now you can complete a case study on Max. Max is 35 years old with a max heart rate of 184. Using the aforementioned table in your book, try to find a way for Max to improve his 5K performance. So he's looking at the lactic acid / O2 training system. Design an interval training session using the length of work and rest intervals, sets, reps, and recommended heart rates and total workout time. If you're still wanting practice, we can look at a case study too. We have a 40-year-old who wants to start jogging so she can run a 5K. Our goal really here is to improve her oxygen system. We're not looking to improve her pace yet or to increase her lactic acid threshold. We're just looking for her to get 2 through 3 miles. So design an interval training session for her based on the table, looking at length of work and rest intervals, sets, reps, and recommended heart rates. With case study 3, we could also look at somebody who wants to be competitive in a rec league basketball program. We're now looking at ATP, PC, and lactic acid. There's a lot of stop and go and short sprinting in basketball. So we want to design an interval training session for the length of work and rest intervals, sets, reps, recommended heart rates, and total workout time. So when we look at this table, we can see what energy systems are being utilized for each specific sport. And this helps us develop some sort of aerobic training system or anaerobic training to develop that athlete a little more. So as you can see, in baseball, we're not using much aerobic capacity, nor are we using much of the glycolytic system. It's mostly anaerobic phosphagen system glycolysis, so we'd want to train for those kinds of activities. For instance, a common activity is to do sprints around the bases because that is one of the few times that you get aerobic exercise in baseball. Of course, depending on your position, you may get more time spent in different systems. So with training methods for aerobic training, we can also look at runners, swimmers, and cyclists, those aerobic activity individuals. With runners, typically they might train for 80 to 100 miles a week and go on 1 to 3 hour runs. So they're probably going to spend once a week on tempo training or fast-paced training. They're also going to do a greater training volume during the off season. And as you can see, swimmers and cyclists also have their own habits of aerobic and anaerobic training and high-intensity training. For their aerobic training, they typically do 2 to 6 hours rides during cycling, but they might also do a time trial once a week to work on their tempo training. Some other training methods include circuit training, cross training, fartlek training, and active living. So circuit training, as we learned in resistance training, is using different exercises combined into a circuit. So maybe performing 30 seconds of an aerobic exercise before moving on to another aerobic exercise and performing for 30 seconds. This can be combined with 30-second rest breaks in between, or with smaller rest breaks to try to improve aerobic capacity. Cross training just involves using a variety of training methods to improve aerobic capacity. This is also a great way to prevent injuries. For instance, a runner might attempt to cycle or swim on an off day during the week. This improves aerobic capacity, and while it may not be specific to running, it's a great way for them to switch up their training to have more variety, increase their interest in exercise, and prevent injuries and overuse. Fartlek training is essentially Swedish for speed play. It basically means combining continuous training with interval training. It's simply been defined as periods of fast running intermixed with periods of slower running. Active living would be training doing activities of daily living. So even a simple activity such as gardening at a moderate intensity can improve aerobic capacity and VO2 max. So some people use active living to improve their VO2 max, and they may use physical activity trackers to try to get to 10,000 steps a day, or they may walk their dogs, different things like that. And for the right person, this can make improvements in VO2 max. So what we want to focus on as well with cardiorespiratory exercise is focusing on variety. Variety is going to increase the likelihood that a training effect will transfer to vocational and recreational activities. Cross-training specifically is going to transfer into many activities in our daily life that will help us have a better quality of life. Variety also ensures that we're more likely to adhere to exercise. We can look forward to doing different training modalities and improving ourselves in different areas, and that can help us improve our quality of life and look forward to exercise. So with volume, we're actually wanting to burn about 1,000 to 2,000 calories per week at a minimum. Remember when I talked about weight loss, I said a minimum of 2,000 calories a week. So with weight loss, we're looking at 2,000 to 4,000 calories a week. With moderate intensity, we want to shoot for 150 to 250 minutes a week minimum. And with weight loss, we want to shoot for 250 to 500 minutes per week to achieve the benefit of weight loss. When we progress, we want to look at what stage our client is in. So when we're in the initial stage, we're in the adaptation stage. It does not take much for us to adapt and to make improvements in this initial stage if we have not been working out. We're going to focus on lower intensity, shorter duration, shooting for 3 days a week for about 4 to 6 weeks. We're also going to be looking at a heart rate reserve of 40 to 60%. Now, recall that if we have somebody who's very deconditioned, we could also start at 30% heart rate reserve. We want to at least shoot for 12 to 15 minutes of workout time initially. This may not seem like much, but for the exerciser that's a beginner who has not done anything for several months or years, this is sufficient for those initial improvements. We also want to look for signs of intolerance, monitoring our client for appropriate breathing techniques, heart rate and responses, no undue shortness of breath and fatigue, and we want to work our way up to an increase in 5 to 10 minutes every 1 to 2 weeks, remembering that time is the first variable we manipulate for progression. When we hit the improvement stage, we're looking at a further gradual increase. So at around 16 to 20 weeks, we are in the improvement stage. We can actually increase frequency, intensity, or time, just not all in the same week. And our main focus is progressive overload. Our main end goal is to get to our 150 minutes a week of aerobic activity, or 3 to 5 days a week of 30 minutes. We're going to be exercising at 50 to 85% heart rate reserve or VO2 reserve. This is a pretty big range, but we can have more variety and intensity as our clients progress. And we may focus on some moderate intensity bouts of exercise and also add in some interval training or high intensity bouts of exercise when our clients are ready. What we want to truly make sure is that our clients are still interested and they aren't going to drop out of the program based on lack of interest or lack of motivation. We also want to make sure that with the same workload, we're experiencing the same response in RPE or heart rate. We don't want exercise to have become more difficult at the same level of intensity. If this happens, or if they have aches and pains, we may need to take a step back and decrease the amount of exercise that we're having our client do. The maintenance stage is when we've hit 6 months of exercise. At this stage, we're actually looking at long-term adherence. Yes, we want to still make improvements in VO2 max, and we also want to make other physiological improvements, but our main goal is to find out what is going to intrinsically motivate the client. We want to find out what they enjoy, and we want to help them engage in a variety of program activities. This is a great time to add in skilled sports or cross training to keep them motivated and active and give them something to keep their routine from becoming mundane. When we're progressing, we should be able to expect a 10 to 30% increase in aerobic capacity. Note, though, if we have detraining, we can expect at least a 50% decrease in our VO2 max or aerobic capacity within as little as 4 to 12 weeks. So we want to make sure that we're making those improvements and progressing and not detraining for too long. We may be back where we started from within as little as 3 months. So make sure we remember that it's important to have our warm-up, a training portion, and a cool down for our training session. So the purpose of our warm-up is to get our body ready for exercise. Remember, we're going to be at around 40 to 60% of our VO2 or heart rate reserve. Unless we have a sedentary client, then we might be at a lower intensity for our warm-up. Then in the training portion, our goal is to improve our performance for VO2 max, reduce our risk of disease and other preventable conditions, and reduce our stress. So we want to shoot for 20 to 60 minutes of continuous or intermittent activity, such as multiple bouts of 10 minutes during the day, and we want to shoot for at least moderate intensity when we can. With our cool down, we want to gradually decrease intensity for about 5 to 10 minutes. We also want to include some form of stretching, such as static, dynamic, or PNF stretching. The purpose of the cool down is to decrease heart rate and prevent pooling of blood. We also want to prevent post-exercise hypotension or low blood pressure. We can also combat an increase in plasma catecholamines, reducing the risk of serious arrhythmias. With aerobic exercise, we would expect a decrease in heart rate of around 12 beats every minute or so. So a great way to check and make sure they're recovering is to check their heart rate at the very end of exercise, and then every 1 or 2 minutes, make sure their heart rate is continually decreasing. Now, not everybody will decrease at a rate of 12 beats per minute. That recommendation is for those who are of general fitness already. Sedentary clients are going to have a harder time decreasing their heart rate, and it's going to take them longer, so it might be wise to add in a little longer cool down for those individuals. As we can see during this sample exercise session, we've started exercise with a resting heart rate of approximately 70, and then we've gradually increased our intensity to where we've reached our peak intensity, or peak heart rate, rather, at around 45 to 50 minutes of exercise. So we see that gradual increase, of course, for the first 10 minutes with our warm-up. When we're going from sedentary to activity, we're going to see a bigger jump in heart rate. And then as we exercise for several minutes at a moderate intensity, then we're going to actually sustain heart rate or have some slight increases due to physiological changes during the exercise program. And then we'll have a cool down, and we'll be at recovery when we stop exercise. Note that even after we've stopped exercise, we're probably not down to our resting heart rate. So we should take the pulse at different times to determine normal heart rate responses to exercise and from warm up and cool down.